All right, let's give this a try. Chapter 14 is talking about leading, delegating, collaborating. And this is something we're going to you will talk more about in a course you're going to take later in the program, RNSG 2121, Management or Leadership. The whole course is about this. So this is just a little taste of what's coming up. Very important for you to know. Your book, I don't quite agree with some of the things that your book says, and I'll tell you why when we get to the slides. But we're going to trudge through this and talk about it. And I'll do a lot of reading of the slides because your book says it very well, very accurately. So we'll give this a try. There are leaders, and this is where the discrepancy comes in, and what your book says and what I believe, and in what your management book says too. They pretty much lump leaders and managers as the same role in an organization. I think that managers are leaders, should be leaders, but maybe not always. Sometimes the leader in an organization on a unit could be someone that's their designation is not manager. We've all worked somewhere where a person very influential was very influential in the way the unit was run, but they were not the boss. So that's the little discrepancy that I have with the way your book tells it. So, but it's your book. That's what was adopted by the curriculum committee. I'm a big girl, so I will talk to you about what your book says. Leaders, this is true. A leader influences patients, families, and others toward a vision or goal. Of course, that's true. They empower others many times, yes. Hopefully, managers certainly do that. They communicate a sense of direction. Yes, they do that, of course. And many times it's not a verbal communication. It's something that they've done on their unit, in their life, toward a patient, toward a situation that makes everyone know that they have a sense of direction. And they demonstrate self-confidence. And that is very true. And that is one of those instances where you need to fake it till you make it type deal. And you can ask a lot of managers and leaders, and they'll tell you they felt very insecure initially, but after they had done the job and acted like they knew what they were doing, it became second nature, and they were very effective. The characteristics of a leader is competence, trustworthiness, self-assuredness, decision-making ability, and prioritizing skills. And in management, you'll talk more about prioritizing, and we've talked about it this semester already. Some of the tasks of leadership are envisioning goals, being a forward-thinking thinker, knowing what you're going to do or what's needed for a unit or an organization, affirming values, motivating others, and we all know good and bad ways to motivate others. As a parent, it's very, and a spouse even, you use motivational tactics many times. Hang on just a minute. Oh my goodness. Okay, here we go. I'm sorry. Task of leadership, people that are leaders need to do these things: envision goals, affirm values, motivate others, manage, achieve workable unity, develop trust, explain, serve as a symbol, represent the group, and then renew themselves. I'm going backwards, sorry. Management provides the structure and direction necessary to accomplish goals and outcomes that are known and where there's a system in place to achieve the outcomes. Since you've all been employed, you're going to be able to relate to a lot of this stuff. It's not going to be news to you because you have been, if not the manager on some place you've worked, you've been the follower. So, and they're all important uh, roles in the effective organization of a unit. A manager is any staff member who bears responsibility for the work of others, meaning they set schedules, they determine workloads, those kind of things, um, and they must ensure the completion of an organizational process. Usually, they have to answer to someone else for the work that's being done. They also guide the processes necessary to accomplish tasks necessary to achieve organizational outcomes. Just like in the nursing process in a plan of care, there we have outcomes, not patient outcomes, but outcomes for the unit. As I said, followership or being a follower is a very important role also. It's not a passive process, even though sometimes people think it is. The follower has behaviors that contribute to the healthcare team's goals, and they're able to demonstrate collaboration. They're able to influence their peers and what goes on in the unit, and work with the leader or manager to accomplish goals and outcomes. A follower should be to be for a follower to feel effective in a unit and as an employee, as a person, they should be willing and able to question, debate, compromise, collaborate, and act as well as being accountable for those actions. And you will experience that more than ever when you become a registered nurse and the pride you'll feel in the ability to think through problems. Leadership characteristics is the ability to influence outcomes through positive interactions with team members. And in that instance, that is, I agree with that because the leader might be probably not somebody from housekeeping because they're not very regular, but somebody that's not licensed or that is not usually designated as a leader, who because of their abilities and their personality, they in some instances they do become leaders. The characteristics of leaders is that they recognize the strengths and weaknesses within the team. Managers should also recognize this. They use the weaknesses and strengths to make everything come to a positive outcome. They empower all team members to do their jobs for which they're most capable and even stretch them. What word am I looking for? I'll think of it in a minute. And they delegate assignments, tasks, and duties to the best individuals for the particular jobs. And in this instance, that would not be a UAP or something. That would have to be, in nursing, would need to be the registered nurse. To define the leadership roles, directing and supervising others is a means to control a situation, and then also to manage patient care, oversee that plan of care for patients, and directing others toward the achievement of the outcomes that have been set forth. A manager has leadership qualities, acts as an advisor, and influences the beliefs of others. And we've all worked for managers that are not very good at that. And probably management is not their calling, but they're in that position because they wanted it or because there was no one else to do it. The leadership role is both an expectation and an earned role. Leaders are decisive, they have sound judgment and the ability to articulate fluently. So in the United States, they really need to speak English and speak it well. They have self-knowledge, respect, trust, integrity, vision, That's really important. Have visions, a forward thinker on the unit. Participation, learning, communication, and catalyzing change. Isn't that a good word? Catalyzing. And and have integrity and be able to let others know about their integrity. There are leadership styles that your book outlines: democratic, autocratic, laissez-faire. All of these you could probably identify and put a person's name with each one of these styles. We're not going to talk about them. Please read them in your book. Um, some approaches toward leadership, either empowerment. It could depend on the personality of other people in the on the team. Um, it might be that different styles of leadership are used depending on the situation and the group of people. All group members need to be able to openly communicate. Everyone needs to have clear goals and objectives that are a part of the plan of care, and everyone should understand his or her role in meeting those goals and feel a part of it and feel satisfaction when those goals are met. Transactional leadership is not a very positive model of leadership, is when the boss makes decisions without staff input. They're motivated by either rewards or their performance is monitored and they're corrected immediately, um, or they wait until a problem occurs and deals with it later, all of which are not as effective as possible. They rely on their power and authority to reward or punish performance. We've all worked with someone, well, hopefully you haven't, but I have worked under someone that this was their leadership style. And it's usually found in stable work environments where there's not a lot of change. It's very static. More about transformational leadership. Um, that's transactional. This is transformational, where they seek and welcome input from staff, bring out the best in their people. They identify the common values that everybody has. They're charismatic, inspirational, motivational, and intellectually stimulating, and treat others as unique individuals, which is sometimes difficult to treat everyone as a unique individual. And some people are more better than others in seeing those traits in people. They motivate followers to reach their fullest potential, even if that means that that person is going to go further than um, that individual. When you see that traits in a person, um, and they're going to achieve greater things than you are. Supports creativity, uniqueness, and problem solving, and has an individual spirit of freedom. All very positive characteristics, and this is transformational. Servant leadership, many times, is what nursing ends up being. It emphasizes service to others, including employees, customers, and the community. Focuses on the needs of others, empathizes with them, and is attentive to the concerns of the followers. And it involves listening, empathy, healing, persuasion, awareness, foresight, conceptualization, commitment to the growth of people, stewardship, and building community. So those all sound like characteristics of a nurse, don't they? So many times servant leadership is the type of leadership that nurses have. Quantum leadership is effective mostly when there's lots of change in a crisis on a unit. You have to be able to establish and promote nurturing relationships, which usually nurses are very good at that, and approach decision making through empowered followers. It's been very interesting to watch. Like if I have students in a clinical group, you get to know them very well, which I really love, and but get to know their characteristics, and then watch after they graduate what kind of employment they seek and are able to work at, because many times it fits their personality so perfectly that you almost knew that that's where they would end up. Many times I'm very surprised they're working there, and they're very happy and feel very fulfilled in a position. So this is interesting, talking about different leadership styles. There's also emotional intelligence. There's four domains: self-awareness, self-management, social awareness, and relationship management. And this is something that is certainly particular to the profession of nursing. So it's a good thing we're mentioning it here. Ethics, uh, there's a moral and ethical dimension to leadership. And the five principles are serving others, showing justice, respecting others, honesty, and building community. All very positive and something that's not going to be very hard for any of you. The ethical responsibilities of leaders is to treat followers with dignity and respect and be sensitive to their interests, needs, and concerns. Culture in leadership is also important. That can that competence can extend to the workplace as well. And here again are the four generations of the workforce and what they bring to the table as far as um, cultural competence. You can read that. Delegation, probably the most important thing about this chapter, and we, like I said, it will be talked about again in a course you'll take during fourth semester. But the definition of delegation is assigning tasks or duties to an entrusted individual, getting work done, and directing the performance of one or more people to accomplish organizational goals. The, the National Council of State Board of Nurses has delegation guidelines, and here's a hyperlink to it that you can go to. The next, I don't know, 5 or 6 slides talk about it, so I'm not going to click it for you to see, but I don't think it'll be the last time you'll see it. But it delineates the responsibilities of a licensed nurse, a nurse leader, and a delegatee, which could be an LVN, could be a UAP. So we'll look at that. And I'll do a lot of reading. This model comes from your book and from this article from the National Council of State Boards of Nursing. And I think probably the most important thing on this Venn diagram is this middle part right here. Our biggest, one of our biggest responsibility is public protection, and also at least two-way communication, sometimes three-way communication, and this one, and training and education. So take a look at this. You might see a test question on this, and it'll certainly help you in your practice in the future. The responsibility of a licensed nurse is the nurse must determine when and what to delegate based on the practice setting, the patient's needs and condition, the state or jurisdiction's employer policies and procedures regarding delegating a specific responsibility. So you as a licensed nurse must know what they are. They must also communicate with the delegatee who will be assisting in providing patient care. You can't just have mental telepathy and think they're going to know what it is they need to do. Many times after you've worked with a person for a very long time, that communication doesn't have to be as extensive, but communication does need to take place. They must be available for questions and guidance, and if they have to be able to perform the task themselves if it's needed. They must also follow up with the delegatee and the patient after the delegated responsibility has been completed. That's the evaluation phase. They must also provide feedback about any issues and any issues regarding the competence level of the nurse leader. As you can follow, the page numbers are all outlined from this document that I remember I hyperlinked 2 slides ago that you're able to get that document if you want. You can also go to the website and get it. The employer must identify a nurse leader responsible for oversight and delegated responsibilities for the facility. They're responsible for delegation, usually formed for the purposes of addressing delegation, must determine which nursing responsibility may be delegated to whom and under what circumstances, depending on their scope of practice, which you must know before you start delegating. Policies and procedure for the delegation must be developed. The employer or nurse leader must communicate information about delegation to the licensed nurses and UAP and educate them about what responsibilities can be delegated. They must also demonstrate knowledge and competency on how to perform a delegated responsibility. I'm not going to read you this. You can read it, but it's very important information on the responsibility of the nurse leader. Here's the responsibility of the person that is delegated to. The delegatee must accept only the delegated responsibilities that he or she is appropriately trained and educated. And they must also maintain competency for the delegated responsibility. There's a slide in a minute that talks about if they're not comfortable with the situation. The delegatee must communicate with the licensed nurse in charge of the patient, and once they have verified and accepted the responsibility that's been delegated to them, then they're accountable for carrying out that responsibility correctly in a timely manner, and then document accurately whatever the facility has set forth as the policy for delegating. Some issues in delegation. The biggest thing in delegation is patient safety, always, always, always foremost. And it must be maintained by understanding the scopes of practice and the skills and abilities of the other healthcare team members. But delegating fairly does not mean delegating equally. That is really shouldn't be an issue, even though we as nurses try to make it an issue. According to the American Nurses Association, there are 3 elements that may not be delegated, and that is the initial and subsequent nursing assessments that require professional judgment. Remember, a licensed nurse must do the initial assessment, then determination of the nursing diagnoses, goals, plans of care and progress, and then any interventions that require the application of professional knowledge and skills. I would think that you would know those on the unit where you're working as you start work. If a person resists delegation, you need to provide deadlines. Don't over supervise. Assess the reason for the resistance or refusal to perform a specific task, and then take appropriate action to remedy the situation. And I highlighted this red because it's very important. Remember that if the patient has not been assessed by an RN, delegation should not occur. Collaboration, a really big word in nursing nomenclature right now, is the definition of it is partnership arranged between 2 or more individuals who have a mutual agreement to work together. So that could be nurse physician, nurse physical therapist, nurse occupational therapist, nurse housekeeper, nurse UAP. It could be a lot of different people that as nurses, we need to collaborate with. Successful collaboration results in agreement on the plan of care and the prioritization of the components of the plan, and then having good communication, effective and excellent communication, and then mutual recognition and respect. And we have to remember that the respect portion of collaboration in any type of communication with our peers. Accountability. The RN must ensure that the plan of care is implemented, evaluated, and possibly modified after the evaluation so that the patient outcomes are the best they can possibly be. And there, the important words, some key words there are the plan of care and the patient outcomes. As professionals, we need to be advocates when we promote someone else or someone else's idea, especially when we're advocates for the client, then we must promote their decisions in a non-judgmental manner. Um, we must assess the patient's understanding of the plan of care and ensure that the patient has all the information needed to make informed decision as their advocate. Many times I used to feel like I was the translator. The physician would come in and talk, and then I would go in and uh, translate what the physician had said. The RN's responsibilities are to care. Yes, it is a responsibility because we have the uh, commitment to preserve the patient's humanity, personal worth, and dignity. We need to speak up when something is unsafe because patient safety is paramount. That's one of our most important needs in life. And we need to advocate for the public and the nursing profession and extend that advocacy to ourselves. The physician is the manager of the medical plan of care, not the nursing plan of care, and we are not the medical expert in any situation, but we must anticipate medical direction, understand any orders written, and foresee how they will affect the patient and the patient care. And again, be an advocate for the client if we don't feel like it's accurate and safe for the client. Decision making is focused on trying to solve an immediate problem, and problem solving is purposeful and goal directed, aimed at identifying and selecting options as part of the problem solving plan change or improvement. The decision making process, much like the nursing process, we define the objectives, identify the options, identify the advantages and disadvantages of each option, select an option, implement the option, and evaluate the results. Very much like the nursing process. Effective decision making and problem solving process is when you gather data from many sources, learn the approaches to the problem situation, observe positive role models in a situation, talk to a colleague or superior who is an effective problem solver or decision maker. Not talking very well this evening. Perform research to increase your knowledge base and take risk using new approaches to problem solving. So we need to be curious and be able to be creative, good problem solvers, and then take risks. Conflict management is not something we all seek out. Conflict is not something I enjoy, but the definition is the opposition of feelings, beliefs, desires, or goals. And then there's different types: intrapersonal within one individual, interpersonal between between or among two or more individuals, intra-group within a group, which you may experience within your nursing buddies, your nursing student buddies, and then intergroup between or among two or more groups. Hopefully we won't have that between Brian and Brenham, but many times it does occur. And I still don't have, after all these years, I still don't have a solution to that. The guidelines for conflict management is privacy needs to be provided. Be willing to talk calmly and rationally. If not, if you can't do that, you're not able to do that, stop the process and discuss it another time and ask for help if needed. Some agencies provide a mediator if things can't be worked out between people or groups. and then it's necessary to call in the mediator. There are different types of resolution. One is a sacrifice resolution, when you just give up. Someone accommodates the other by essentially sacrificing his or her position, thus allowing the other person to have his or her way. And then there's competition resolution, when two parties work competitively instead of cooperatively toward a solution. And there's a winner and a loser, which is not a good resolution. There's a win-win resolution, which is collaborative, when two opposing parties come together to decide on mutual goals. That's when you can look at the positive and not the negative of a situation. And then together they design the interventions to meet those goals, and then again work together to evaluate the outcomes, which is the best model of any conflict management. I hope you'll look at the chapter 14 in your book, especially look at the back at the critical thinking questions. No, look at the key points at the back, and anytime, if you're not able to read the chapter, I've pretty much read the chapter to you, talking in this presentation, integrity recording, and then you should always look at the goals and objectives at the beginning of the chapter and the key points at the end, and then read boxes and pictures and exercises and charts that are within the chapter. Happy nursing and happy future RN. We are done. Isn't that great?